Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about the giant cell tumor. So a giant cell tumor is a bone tumor that is very, very aggressive, although it is benign. So the common difference between a benign tumor and a malignant tumor or a cancerous tumor is how aggressive they are. But a giant cell tumor doesn't fit in that mold. It fits somewhere in between where it doesn't go anywhere, but it's pretty aggressive and can do pretty significant damage to the bone and to the area around that bone. So what are the symptoms? How do you know that it might be a giant cell tumor? One, there's a visible mass. So because the bone is growing like crazy, this giant cell tumor is, you will get a mass or a prominence in that area. You can get bone fractures because it's aggressively attacking the bone. You can get fluid buildup, especially in the joint nearest to this area. Limited movement in that joint because of the fluid buildup and because of the bony prominences and so forth. Swelling and pain at that joint, partially because of the movement is what I would usually say. So how are they diagnosed? How would you diagnose a giant cell tumor? As with any bone tumor, number one is doing a x-ray. On the x-ray, you will actually see something that looks abnormal. You can do a biopsy of this particular tumor, and it can be confirmed as giant cell tumors because of the pathologic appearance under a microscope. And you can do a bone scan. The idea of a bone scan, a giant cell tumor, as with a lot of tumors, will light up because giant cell tumors are aggressively growing and progressing even though they're not going anywhere. So if you got a diagnosis of giant cell tumor, how would you treat it? The best way to treat a giant cell tumor, of course, is to remove it, and to remove it all the way as much as possible without damaging the bone around it. So you want to protect the bone as much as you can. So you remove it, may need a bone graft or those kind of things. In situations where it can't be removed, sometimes it can be treated like cancer. It can be treated with radiation and to be destroyed that way, where you stop the growth of those cells. Giant cell tumors are notorious. They can come back, so sometimes that can be the problem. So the bad news is the cause of a giant cell tumor is unknown. We don't know exactly why it happens. But if you have a giant cell tumor, it is benign. It can be removed, and that's the best recommendation, is to remove it. This is Dr. Brandt Gibson, and this is